So dental implant cost, you get lots of questions about how much they are. You say people call all the time, patients call, want to know how much it is. So what affects the cost?
So this is the most common question that we get when somebody calls. They know that dental implants are going to be beneficial to them. They want to understand what the costs are and if they're able to afford it.
All right.
So we've identified 9 different things that impact the cost of dental implants. They're not all the same, and we've tried to kind of cover those today. So I've got a few notes here.
All right.
And hopefully we can cover that and kind of go over so folks understand better what the costs are. So the first is the actual implant itself, okay? Implants will cost the doctor anywhere from some as low as $200, as high as $1,200, $1,500 for a good quality dental implant. So the range of the cost of the actual piece of titanium that's going into your jaw ranges dramatically. We've chosen in our office to use the #1 company in the world, Nobel Biocare.
Okay.
That implant comes from the company where the implant was developed, where it was first created. They continue to revolutionize and be at the forefront of all the implants. That costs us more money than something that's significantly less expensive. So the next thing is how many doctors are involved in the process.
Okay.
The traditional model is you'd have to go to one doctor that does the surgery, one doctor that might put on the teeth, and maybe another doctor for some gum grafts. We're going to a lot of different places, and it becomes very confusing and difficult for the patient.
And more expensive.
More expensive.
Okay.
A lot of times you have to wait months to get an appointment with one of the specialists. What we've done in our office is we've decided to bring all that into one roof.
Okay.
So I've taken extensive training so that I'm able to do the entire process from start to finish. You only have one person to deal with, only one place that you have to worry about a payment. We take care of everything under one roof.
Is that why you do it so quickly?
We are able to do it much faster. In fact, in many cases, we can have one consult with you and then schedule your surgery just a few weeks later and have your new smile all ready to go.
Nice, okay.
The next thing that affects the cost is the surgery involved.
Okay.
Each patient's got a different scenario, a different set of surgeries or procedures that are going to be needed for them to get their new smile. Some might need a whole bunch of extractions, significant grafting, so on and so forth. Other folks simply need one single implant. Until we take a close look at what exactly your needs are, we can't quote you a cost over the phone.
But it's easy to do once they get there.
Easy to do.
Okay.
Typically our consults range in time from 30 minutes to 60 minutes. So it's a quick, easy consult. We're able to go over everything and determine what they need, and they can leave with an idea of what the cost is going to be at that very appointment.
Okay, good.
We find that a lot of folks have been told that they're going to need extensive grafting, and they have to go to another location and spend a lot of money.
Like bone grafting?
Bone
we're
grafting.
Talking about? Okay.
The procedure that we do the most of, some people might know it as full arch dental implants or fixed teeth. A lot of times we don't have to do any grafting at all, so they can save money by not having to do that.
Okay.
Another area that's really important that people understand is there's a hefty lab bill involved to the dental office to get you what a great smile is going to look like.
And we're talking about the full upper and lower set of teeth.
We're talking
supported by dental implants.
Correct.
Okay.
So for you to have that, we have to fabricate out of thin air a whole new set. This takes technicians that are extremely well versed in designing teeth to your smile. And then we have to create those. So our office has chosen to take on a lot of investment, and we have 3D printers, mills. So we do this all in our office.
So you make the teeth? Like we literally print the teeth?
We make the teeth, we 3D print them right in our office the same day of the surgery. So we have a technician who's extremely gifted in this that's able to design the teeth to your specifications, and then we deliver them to you later on.
So that saves you money having an in-house lab?
It saves both us money as well as the patient money because we're able to cut costs of having to pay a lab a large fee.
Okay.
One area that's really misunderstood in all of dentistry is dental insurance. You know, for your typical cleaning, maybe a filling here and there, your crowns that you need, insurance does an okay job of helping you cover that. That'd be an entire different...
Like max payout for typical insurance is what?
It's
per year.
Usually we see around $1,000, maybe $1,500. I've heard rumors that there's a $2,000 plan out there. I haven't seen it yet, but they tell me it exists. For the procedure that we're talking about, where we're replacing all of your teeth, dental insurance really doesn't come in.
So like Medicare, Medicaid doesn't cover this at all?
No, they do not cover it at all. Health insurance typically doesn't cover anything at all. So what we've decided to do in our office is bundle the pricing together. If I was to break out all of the pricing for every extraction, any grafts that might be necessary, every implant that we do, the teeth, the temporaries, all of the time of all of our staff, the price would be way more if I'm trying to use dental insurance. So what we've done is we've bundled it into one easy to understand price, if that's the procedure that you need. and we go over that in our office, and that's all you have to worry about. We eliminate having to mess with insurance
What
altogether.
about payment plans?
We offer payment plans, sometimes as long as 10 years, depending on how long the patient wants to go.
Okay.
We've tried to really work and do everything that we possibly can to make this as affordable as possible.
Now, you have to have decent credit or a little bit of credit?
You'd be surprised. I mean, you do have to have some level of credit. You're taking on a line of credit from an institution. But with that said, the people that we finance, it's everyday people just like you and I. We've done several single mothers. We've got people that are retired that we do regularly. So, some folks have been told in the past that they maybe didn't qualify through a certain credit institution. We've got different options than I think a lot of people have seen before that'll help them with that. Now, what the teeth are made of is important too. So in the traditional sense, they use plastic denture teeth. We don't do that. For the temporary set that you get the day you leave, we use 3D printed resin material that's very strong and looks really great. We also use the gold standard for their final set, which is translucent, beautiful. It's called zirconia. It's a ceramic. It looks just like veneers in Hollywood.
And you say it's not that much more than these
It's
other...
not that much more. That's why we've invested in a mill that makes it in our office so that we don't have to charge and upcharge. Most places are charging extra for zirconia. We're not.
To get the good teeth?
Yeah, it's all we do. Another thing that affects the cost is the warranty. Some places don't offer any warranty or any maintenance on this at all. We offer an extensive warranty, and we also have a full regular dental office to take care of all the maintenance that you might need. Is it
because, you offer a warranty because you have the machines that are actually making the teeth?
Well, we're able to do that, but we also are confident in the work we do and stand behind it.
All right.
We find that that's extremely important. Sometimes when you go somewhere else, you might find that there is no warranty and there is no ability to get these new fancy teeth that you got cleaned. We have everything in office so that we can take care of that for you.
Good.
The next thing that affects cost, and a lot of people think that this is the same thing, but it's not, is snap-in and snap-out dentures. What snap-in and snap-out dentures are is exactly what they sound like. They're dentures, they're plastic, and they come in and out of your mouth. We're talking about fixed teeth that are screwed in and stay in and are made of ceramic material. They look great, they feel great.
So they don't come out?
They don't come out, and you can chew literally anything that you could chew with your regular teeth.
Okay.
People think that these cost a lot more than the snap-in and snap-out. They don't. Because we've invested in all this equipment, the cost difference is minimal.
Okay. Would you say less than 1% of the dentists in America, I'll put you on the spot, have the setup, the in-house lab that you have going on right there?
I would have no way of knowing, but it's 1% seems even high to me.
Okay.
There's very few places that have invested as much in technology as we have.
It's nice. Okay. Yeah. Sorry for the interruption.
Oh, that's all right.
And the last one?
And then I think it's really important that folks understand the experience and the training of who's performing the surgery.
Okay.
Are we going somewhere where the doctor's never done this before, or is this pretty much all they do? For us, this is what we do every single day. We have invested both in time, training. I teach this throughout the country as well as go and study it. In fact, later on today, I'm flying to Nobel's annual symposium.
They're the big implant company.
They're the big implant company, and to learn even more about
Is there that much to it?
There's that much to it.
Okay.
And it changes, as with anything, things change by the day. So we work off of the old principles, but technology is advancing rapidly.
Okay. And so when somebody calls your office and says, how much are implants? It's not that easy, right?
I would love, Randy, to be able to give them an answer right on the phone.
But it's misleading. Would you say it's misleading a little bit?
I feel like it's totally misleading. Whether I give you a low price or a high price, either one isn't going to be correct and isn't going to be right for the person on the phone. So we really need to see them in our office. And again, it's a quick, usually about 30-minute appointment, and we can give them a really good idea at that appointment of what it is that they need.
All right. We're going to take a quick break. We come back. More about the implant process.